16-year-old Katrina was very conflicted when she discovered she was pregnant in the fall of 1988. On the one hand, she loved her boyfriend and she wanted to have her baby, but on the other hand, she was very young, doing well in school, and concerned that taking care of a baby would derail her education. Unfortunately, in choosing death for her baby, Katrina inadvertently chose death for herself as well. This is Christina with the Sisyphean Journal, and today is December 6th. Katrina found out that she was pregnant for sure on October 31st, 1988, when she had a positive pregnancy test. So on November 4th, she went to the family doctor who confirmed that she was pregnant, about 14 or 15 weeks. So she discussed with her friends what she should do. Some of her friends talked to her about following her heart and having this baby with the boyfriend that she loved so much. But others reinforced her concerns that she was really too young to have a baby. Now, there aren't any records of the discussion Katrina had with her doctor in the medical board documents that abortiondocs.org provides. All it says is that the doctors referred Katrina to a woman's choice, aka a Jacksonville Women's Health Center or Jacksonville Women's Health, and sticking the letter A, so a woman's choice, a Jacksonville Health Center, was a way of moving the clinic up higher in the yellow pages so that the woman would see it first. Now, the doctor referred her to this clinic because he himself did not perform second trimester abortions. Now, Katrina didn't go to the clinic for a month. That confirms how conflicted she was. It was taking her a long time to make up her mind whether to have her baby or go through with the abortion. It was December 5th before she finally entrusted her life to the staff at a woman's choice. Now, the clinic records show no evidence that anybody took any steps to determine how to provide appropriate care for Katrina. There's no evidence of a medical history, which would have disclosed that Katrina's pregnancy was estimated at 14 or 15 weeks, a full month earlier. And a medical history also would have revealed that Katrina had a history of irregular periods, which would make it even more important to be very careful about estimating the gestational age. Now, even the Centers for Disease Control, which is rife with abortion rights activists, even they admit that at 16 weeks, abortion, by their meager, inadequate calculations, is as dangerous as carrying to term, and the risk increases exponentially for every week after that. Very, very important to determine how far along the pregnancy is so that you can determine the level of risk. No physical examination of any kind, much less a careful physical examination to determine the age of the pregnancy, was noted. There was no ultrasound performed, and Dr. Herman Miller simply charged ahead with a routine suction abortion, which would only be appropriate for first trimester pregnancies of 12 weeks or less. So even going into it, they were letting this poor girl down. Now, during the abortion, Miller noted that the suction was taking out way more placenta tissue than he expected. And the medical board noted that Miller failed to take this second opportunity to perform an ultrasound and get a clear idea of what he was doing. Instead, he just kept going, making no notes at all about how he performed the procedure or any evaluation of the fetal remains, other than to estimate that Katrina had actually been 22 weeks pregnant, which is far enough along to determine that the baby could have potentially survived if born alive. He made no effort to assess the baby's viability. And remember, Katrina was already very conflicted about whether to have her baby or go through with an abortion. How much difference would it have made to her to know that her baby was potentially viable? We can't know. After completing the abortion, Katrina only had 30 minutes in recovery before the doctor prescribed Stadol, which is a synthetic opioid. Clearly, she was in a lot of pain. And Phenergen number 3, a drug to prevent nausea and vomiting, and methazine, a drug to control obstetric bleeding, and another drug that I can't find references for. So obviously, she was in a lot of pain. She was nauseous, perhaps even vomiting, and she was bleeding heavily enough that he was giving her a drug to control it, and then he sent her home. So she died in the night, sometime between 2 a.m. and 6:30 the next morning. Excuse me. Not COVID, I promise. Now, judging by the news coverage, Katrina's family was probably just unable to wake her in the morning and discovered that she was dead. So, the medical board did take disciplinary action against Miller, including limiting his scope to performing second trimester abortions. Hello? They let him keep his license in spite of his appalling care of Katrina and the staggering lack of judgment he showed in failing to even examine his patient prior to surgery. And I'm not sure how they could trust him to limit himself to early abortions when he didn't even bother to determine the gestational age prior to firing up that suction machine. So really, the medical board betrayed every woman that would walk into that clinic after Katrina did.